22-year-old Doco Charlie has been feeling sick for a few months. On this day, he's on his way to meet a counsellor at the Friendship Hospital in Bangui, capital of the Central African Republic. The news is not good for Doco. Medical tests have revealed that he's HIV positive. It's a grim task for the counsellor to inform him and his family of the results. UNAIDS, the joint UN programme, estimates there are more than 35 million people infected with the deadly virus around the globe. More than 24 million of them are in sub-Saharan African countries. With more than 14% of adults living with HIV/AIDS, the Central African Republic is one of the hardest hit countries. Dr. Marcel Massenger, coordinator of the National AIDS Programme, explains.
In the 1990s, that's what people were saying. They were asking, you talk about AIDS, but show us somebody who's got it so that we can believe you. Therefore, the lack of trust that AIDS was a problem 10 years ago has created this crisis today.
The impact of the disease on already depleted health institutions is evident. In all hospitals in the country, AIDS patients take the majority of the beds. The lack of effective drugs makes treatment impossible and shortens the life of patients. The social and economic results are devastating. United Nations agencies, including the World Health Organization and WHO, are working with the government to fight the virus. They've established a thematic group to coordinate efforts. The WHO representative in the Central African Republic is Dr. Baba Musa Amadou.
Particulièrement, nous nous occupons des aspects liés à la surveillance épidémiologique.
Particularly, we take care of matters which are directly connected to the epidemiological monitoring. Secondly, we reach out to the people who live with the disease. We give them support. We help them to get organized, especially through money-making ventures. We reach out to young people.
This group is living with HIV/AIDS and meets regularly at a restaurant in Bangui. United Nations officials and counsellors join them to discuss the latest developments in the fight against the disease and to provide financial and moral support. HIV is spread through the exchange of infected body fluids. It can also be transmitted through contaminated blood. UNAIDS works with the Ministry of Health to ensure that the country's blood reserve is free from HIV contamination. All donated blood now should be tested before transfusion. The campaign in the Central African Republic also includes preventive measures. With funding from the UN Fund for Population Activities, UNFPA, a voluntary group, Lovers Plus, sells condoms to wholesalers at a discount rate. It's made millions of condoms available at an affordable price. The aim is to reach the most sexually active group, young adults. HIV/AIDS is spreading rapidly in the Central African Republic, one of the world's least developed countries. The virus threatens a national catastrophe. Finding a way out of this crisis globally will be discussed at a special session of the United Nations General Assembly on AIDS in New York in June this year.